Hello, beautiful souls. I'm Dr. Anna Schneider, your friendly back pain warrior with over 15 years of experience helping people just like you reclaim their strength and joy. Today, we're diving into a topic that's close to so many hearts: back pain in early pregnancy. If you're expecting, or know someone who is, and that nagging ache in your lower back has you wondering, is this normal? Should I be worried? You're in the right place. Spoiler alert, you're not alone, and you can take control. Pregnancy is a miracle, but let's be real, it can feel like your body's staging a rebellion. As a doctor and a woman who's seen it all, I'm here to break down the science, bust some myths, and light a fire under you to own your health. Stick with me, because by the end of this, you'll feel empowered, not defeated. Let's get started. Drop a comment below and tell me where you're watching from. Are you in New York, Sydney, Hanoi, or somewhere else? I'd love to know. Let's start with the big question: why does your back hurt when you're barely showing? I've had countless patients come into my office, some glowing, some grimacing, asking, "Dr. Anna, I'm only 8 weeks along, why do I feel like I've been hauling bricks?" Here's the science, broken down so it's crystal clear. Pregnancy isn't just about growing a baby, it's about your entire body transforming to support that miracle. Even in the first trimester, your hormones are working overtime. Take relaxin, for example. This little hormone starts flooding your system early on. Its job? To loosen up your ligaments and joints, especially around your pelvis, to prepare for delivery down the road. Sounds great, right? But here's the catch: when those ligaments relax, your spine loses some of its natural stability. Your lower back, in particular, takes the hit because it's already curving to balance your body. Then there's progesterone, another hormonal MVP. It's busy helping your uterus grow, but it also relaxes your muscles. That means your core, those deep abdominal muscles that usually act like a corset for your spine, starts to slack off a bit. Add in the fact that your uterus is expanding, even if you can't see it yet, and it's subtly shifting your center of gravity. Your posture adjusts, your back compensates, and boom, hello, ache. Now, let's talk numbers. Studies show that up to 50% of pregnant women experience back pain at some point, and for many, it starts in the first trimester. That's half of you warriors out there. So if you're feeling it, don't think you're weak or unlucky. It's your body doing its job, just maybe a little too enthusiastically. Here's where I get real with you: this isn't a sentence to suffer. You're not a victim of pregnancy, you're a creator of life. Understanding why this happens is your first step to fighting back. Tell me in the comments, have you felt that ache yet? When did it start for you? I'm curious. Okay, so we've established that back pain in early pregnancy is common, but is it normal? As a doctor, I'm here to give you the straight talk. Yes, in most cases, it's totally expected. Your body's adapting to a seismic shift, and that takes effort. But I wouldn't be doing my job if I didn't flag when it's time to pay closer attention. Let's break this down together. Normal back pain in early pregnancy usually feels like a dull ache or stiffness, often in the lower back or across the hips. It might get worse after standing too long, sitting in a wonky chair, or even lying down without proper support. Sound familiar? That's your body saying, "Hey, I'm working hard here, give me a hand." But here's where my years of experience kick in: there are times when back pain isn't just par for the course. If it's sharp, stabbing, or comes with other symptoms like bleeding, cramping, or a fever, that's your cue to call your doctor ASAP. Those could signal something more serious, like an ectopic pregnancy, a urinary tract infection, or even early miscarriage risk. I don't say this to scare you, knowledge is power, and you deserve to know when to act. Another red flag? Pain that radiates down your legs or feels like an electric shock. That could hint at sciatica, where a nerve gets pinched, often thanks to that shifting pelvis. It's less common early on, but it happens. I've had patients describe it as, "Dr. Anna, it's like lightning in my thigh." If that's you, don't tough it out, reach out to a pro. Here's my promise to you, most of the time, your back pain is just your body flexing its superpowers. You're growing a human, cut yourself some slack. But if you're unsure, trust your gut. You're the expert on your body. So, quick question for you all, has your pain been a steady ache, or something sharper? Share below, I'm here to help you sort it out. Now, let's flip the script. You're not here to just hear about back pain, you're here to beat it. I've spent years guiding women through this, and I'm handing you the tools to take charge today. Pregnancy isn't a passive ride, it's your chance to shine as the strongest version of yourself. Ready? Let's do this. Step 1, move smart. First up, movement is your secret weapon. I know, when your back hurts, the couch looks like paradise. But hear me out, gentle activity keeps your muscles engaged and your joints happy. Try this, stand up right now, yes, right now, and do a slow pelvic tilt. Tuck your tailbone under, then release. Feel that? You're waking up your core and easing that lower back pressure. Do 10 of those a day, and you're already a rock star. Walking's another gem. Aim for 15 to 20 minutes daily, nothing crazy, just a stroll. It boosts circulation, loosens you up, and reminds your body who's boss. One of my patients, Sarah, told me, "Dr. Anna, I started walking every morning, and it's like my back said thank you." What's your favorite way to move? Drop it in the comments, I might steal your idea. Step 2, master your posture. Next, let's talk posture. Your spine's begging for some love here. When you sit, use a small pillow or rolled towel behind your lower back, think of it as a hug for your lumbar curve. Standing? Imagine a string pulling you up from the top of your head, shoulders back, chest open. It's not just about pain relief, it's about standing tall as the powerhouse you are. Sleeping's tricky early on, but prop a pillow between your knees if you're a side sleeper. It keeps your hips aligned and takes the strain off your back. Trust me, your body will thank you by morning. Step 3, stretch like a goddess. Stretching is non-negotiable. Here's my go-to, the cat-cow stretch. Get on all fours, yes, even with that tiny bump, and arch your back up like a cat, then dip it down like a cow. Flow through that for a minute, breathing deep. It's like a reset button for your spine. I've had patients swear by this, and I do it myself after a long day. Try it tonight, let me know how it feels. Step 4, heat, ice, and TLC. Heat packs or warm baths can melt that tension away, 15 minutes of bliss, and you're golden. If it's more of a sharp ache, try ice to calm inflammation. And don't skip the TLC, massage your lower back gently or ask your partner to step up. You deserve it, mama. Step 5, build your team. Finally, don't go it alone. Chat with your OBGYN about your pain, they might suggest physical therapy or prenatal yoga. I've seen women transform their pregnancy experience with a little expert backup. You're not weak for asking for help, you're smart. Here's my challenge to you, pick one of these tips and try it today. Then come back and tell me, did it work? What's your back saying now? You've got this. Let's bust some myths while we're at it, because misinformation? It's the enemy of progress. Myth 1, back pain in pregnancy means something's wrong. Nope. It's usually just your body adapting. Myth 2, you can't do anything about it. Wrong again, you just heard 5 ways to fight back. Myth 3, rest is the only answer. Rest helps, but too much can make you stiffer. Balance is key. Now, let's talk mindset. I've seen patients crumble under back pain, not because it was unbearable, but because they felt powerless. You're not powerless, you're pregnant. That's strength incarnate. Every ache is proof of your body's incredible work. So shift your thinking, this isn't a burden, it's a badge of honor. Picture this, 9 months from now, you're holding your baby, and that back pain? A distant memory. You're not just surviving this, you're thriving through it. I've had patients tell me, Dr. Anna, I didn't realize how strong I was until I owned this. That's you, right now. What's one thing you're proud of about your pregnancy so far? Share it below, I'm all ears. Alright, my warriors, we've covered the why, the what, and the how of back pain in early pregnancy. You're not just normal, you're extraordinary, and you've got the tools to prove it. I'm Dr. Anna Schneider, and it's been an honor to walk this with you. Here's your homework. Try one tip from today, whether it's a stretch, a walk, or just a mindset shift, and let me know how it goes. Hit that like button if you're ready to take control, and subscribe so we can keep this journey going together. I've got more coming your way. Before you go, drop a comment. Where are you watching from? Are you in London, Tokyo, Sao Paulo, or somewhere else? And tell me, what's your back pain story? I read every single one, because you're not just viewers, you're my community. Let's inspire each other. See you in the comments. Stay strong, stay proud,